Before taking the medication, please take the following points into consideration. Wash your hands thoroughly before preparing the medication. If the medication is in the fridge, take it out 5 minutes beforehand to allow it to reach room temperature. Try to take the medication at around the same time of the day, choosing a different area of the abdomen each day to avoid irritation. Around the injection site, you may experience a local reaction, and one or more of the following symptoms may appear: redness, pain, swelling, irritation, or bruising. These are normal and disappear after a few hours. Once you have finished, place the remaining items in a suitable container or bring them to your nearest IVI clinic. Find a quiet place and get the materials you need for the injection ready, placing them on a clean surface. The box of MENOPUR contains 18 disposable syringes graduated in international units, 1 vial of powder, 1 needle for injecting the solvents into the vial, 2 syringes pre-filled with solvent, 18 disinfecting wipes. Use a suitable container for disposing of these materials after use, or bring them to your nearest IVI clinic. Pay close attention to the following instructions and do not hesitate to get in touch with your IVI centre if you have any questions. Open the box and remove the contents. Open the sealed pack containing the vial of powder, the 2 pre-filled syringes and the reconstitution needle. Take the blue plastic cap off the vial of powder. Unscrew the reconstitution needle, breaking the seal. Remove the rubber stopper from one of the pre-filled syringes. Attach the needle by pushing it on and remove the cover. Place the vial of powder on the table. Take the syringe filled with solvent and pierce the centre of the rubber stopper of the vial with the needle, pushing it in as far as it will go. Next, press the plunger down, slowly adding all of the solvent to one side of the vial to prevent bubbles from forming. The powder will dissolve quickly, forming a clear solution. Gently detach the syringe from the needle by twisting it, leaving the needle in the vial. Take the other pre-filled syringe and remove the rubber stopper. Attach it firmly to the needle that is inserted into the vial. Press the plunger down, slowly adding all of the solvent to one side of the vial to prevent bubbles from forming. Remove the syringe with the needle from the vial. Mix the contents of the vial by swirling gently with your hand, taking care not to shake too roughly. You should only use the disposable syringes included in the box of medication. Take one of these, remove the wrapping, and pull off the cover. Pierce the centre of the rubber stopper of the vial with the needle, pushing it in as far as it will go. Hold the vial upside down and draw out the prescribed dose by pulling back the plunger. If you withdraw more than the prescribed amount, depress the plunger until you have the correct dose. If any air gets into the syringe, pull back the plunger and tap the syringe gently until the air rises to the top. Press the plunger in again until you have the prescribed dose. Take a disinfecting wipe and thoroughly clean an area of your abdomen below the level of your navel. With one hand, pinch a fold of skin and insert the entire length of the needle with the bevel pointing up at an angle of 45 to 90 degrees. Depress the plunger slowly and steadily as far as it will go. Next, let go of your skin and pull the needle out gently. Press down on the area for a couple of seconds with a wipe while massaging it lightly so that the solution disperses under the skin. Finally, put the cover back on the needle. Dispose of the syringe in a suitable container or bring it to your nearest IVI clinic. To store the medication correctly, please heed the following advice. Keep in its original packaging to protect it from light until use. Before using the medication, Store in the fridge at between 2 and 8 degrees centigrade without freezing. After using the medication, store at room temperature and not above 25 degrees centigrade.